Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hey everybody, welcome to the Namaste Wellness Show, where we talk about all things holistic health for the mind, body, and spirit, for people and pets, with a touch of cultural soul. My name is Laura, I'm your host. Thank you so much for joining me today. Today our topic is going to be mental health, and I have a very special guest, Ms. Severia Adolphus. She's a naturopathic doctor and psychiatric mental health nurse practitioner. She's from the New Life Alternative Facility, where they have integrated services for every individual. They also listen to your story to achieve your mental health balance. They use alternative methods that bring Eastern and Western knowledge of health care together to accomplish your goals. New Life Alternatives is comprised of a specialized team of mental health providers with expertise in alternative methods that are holistic, traditional, to provide optimal care. Their holistic model encompasses other methods to heal mental health from the inside out. Natural Life Alternatives has a convenient virtual video platform designed to meet you where you are. If you are interested in therapy, medication, or if you're on too much medication and would like to scale down, or if you are symptomatic and would like something other than the traditional medications, they offer all of the above. They welcome all levels of consciousness to proceed towards your goal of healing. And they invite you to contact them either by email and phone. They also, Dr. Adolphus also offers a 15-minute consultation, which is free. So welcome, Severia, to the show, Dr. Adolphus. How are you?
Thank you. I'm fine. Thank you for having me.
Okay, I'm so glad to have you here. I just want to say a little bit about how we met. We were actually both working at an outpatient mental health facility for children. You were in the clinical psychiatric part of the office, and I was working in support, customer service, and medical records. So what I really found impressive about you, Severia, was that I've worked with many psychiatrists, psychologists, and mental health professionals, and in my career and working in the mental health field. But what I found that was really special about you is when I met you, you were not only doing conventional psychiatric mental health care, but you were also interested in offering holistic approaches. So I found that very interesting. And when I decided to do my podcast, I knew that I wanted to have you on the show. So I'm really excited to have you here. So let's just start about talking about a little bit about yourself, your background, and what inspired you to become interested in a career in mental health.
Well, my background, I've been in nursing for some time. It's been 30 plus years.
Oh, wow.
And I've encompassed a lot of different areas in nursing, from cardiac, respiratory, just medical, everything. And I found that mental health was everywhere in every area that I worked. There was always a need for, some mental health, some mental services. Yeah.
Yeah.
So it made me really become interested in pursuing even more about the mental health issues that people were having, even though they were in the hospital for different things, other things, physical things. They still needed that support, that mental health support. And so I found that very intriguing and very interesting. So I wanted to really kind of focus in on that. So I became a nurse practitioner, psychiatric mental health nurse practitioner, in order to, be a specialist in that particular area.
Okay. Oh, that's interesting. I did not know that part of your background. So you said that people that were in the hospital for different types of illnesses, obviously working as a nurse. And in what ways did they express to you that they needed also mental health support?
Well, a lot of times they will talk about, their social interactions with people and how, anxious they were and how some things made them depressed, whether it was their finances or whatever the, case may be. But there's, a lot of reasons why people that come in, they're worried about this, they're anxious about that, and they're coming in to take care of their medical issues.
Right. Well, we do know that sickness and illness can cause anxiety, depression, and those types of things as well. Okay. So tell us a little bit about the new life. Oh, I'm sorry. I didn't know if I cut you off. Tell us a little bit about New Life Alternatives. When did that start, and what is that all about?
New Life Alternatives started 3 years ago, and I decided that working in the CMH was good, but I wanted to branch out to do more
Mhm.
because having your own platform of what you want to accomplish with people with mental health is different from other areas of mental health when you're working for someone else. So I
Okay.
wanted to do a little bit more of, a holistic care. And
Hmm.
so I, got on with New Life Alternatives, started that 3 years ago.
Okay.
So it's
And I
so
just
far
want to
really good.
Okay, so I want to just clarify for people listening or watching. You mentioned CMH, and CMH meaning community mental health, correct?
Yes.
So, wow, okay. So, what types of mental health, or what are your specialties in working with mental health clients or patients?
So we just specialize in mental health. We work with all different types of patients, all different age groups,
Mhm.
starting from 5 years old. I must say that we do start at 5. We don't take them any younger than 5, but
Okay.
5 to 100 or whatever, just the whole age spectrum. And
Okay.
we also deal with mental health issues, depression, anxiety, pretty much everything. I wouldn't say that we specialize in any one thing,
Mhm.
but we just kind of, give the resources, support, and all those things, whichever diagnosis that you have.
Okay, so you do it from a holistic approach. So what would you say are the most common mental health conditions that you find coming into your office?
I would,
What are the most popular?
okay, so I would say depression and anxiety are the most popular right now, especially since the pandemic.
Hmm.
Depression and anxiety has intensified with a lot of the population. And so a lot of people are seeking out help for these conditions.
Hmm.
And so a lot of times we're getting people who have never been treated for mental health issues before
Hmm.
and coming in with a lot of anxiety and a lot of depression.
Okay. All right. And how do you now, are you still offering conventional? Do you still prescribe psychotropic medications to individuals? You're still doing both, correct?
Yes,
So,
indeed.
so as a on the and I just want to just compare, okay, because I had made the mistake and said you had a PhD, instead of an ND, which is a naturopathic doctor. But one of the things that I've always wondered, what is the difference? I know that you're not a psychiatrist, but you basically do the same things a psychiatrist does. You do psychiatric evaluations, and you also prescribe psychotropic medications. So what's different? What are the difference between what you do and what a psychiatrist does?
Well, like you
Or is
just
it just
mentioned,
the training?
yeah, like you just mentioned, we do this pretty much the same things that the psychiatrist does. The difference is the pathways that we took in order to get where we are. And so, I went through the nursing pathway, and the medical doctor went through a medical doctor pathway. But we practically do the same things. We prescribe, we refer, we order labs, we do everything pretty much that the psychiatrist does.
Okay.
So
So
that's
you Right, prescriptions and the same thing. So then the main difference is that the psychiatrist has a medical MD, and then you as you said, you went from the RN part of it, registered
Right.
nurse practitioner nurse.
Yes, to
Okay.
a provider, psychiatric mental health nurse practitioners. So.
Okay. All right. So what are some of the you mentioned what some of the differences post and pre and post the pandemic? What are some of the you said there are more patients now reaching out for mental health, and most of them are reaching out for services to treat anxiety and depression, correct? Is that what
Yes.
you okay. So when someone comes to you for depression, how do you determine, because there's a term clinical depression. How is that different from just having depression?
Okay. Well, clinical depression is considered moderate to severe depression. So the symptoms are different. So this person may be a person who is not able to do their activity of daily living,
Mhm.
having a hard time going to work, getting out of bed, sleeping. It could be a number of different things that's interfering with their functioning of
Mhm.
everyday activities.
Okay.
So that would be considered clinical depression, like I said, moderate to severe depression. Now, when you look at mild depression, it could be based on someone finances, if they just lost a job, um, and it could be based on the loss of a loved one.
Mhm.
So that would be more of a mild, depression. And people come in for, all levels of depression because it affects them in some sort of way. So they do seek out help. Not everybody does, but we have been noticing that there has been an increase of people coming in to the office for, depression and anxiety.
Okay. All right. So what are some of the symptoms of anxiety? Are they is that opposite? Are anxiety and depression opposite? Like if you when you or if you can just describe, okay, a symptom of depression would be like you said, someone not being able to get out of bed. Um, if someone was suffering from anxiety, would that mean that they a person that's depressed would sleep a lot, whereas a person with anxiety could not sleep? So what are the differences? How would you describe anxiety?
So I describe anxiety as they run hand in hand with depression a lot of times. So if you have depression, you may have some anxiety as well. Or if you have anxiety, you may have a little depression as well. Some of these symptoms that we ask about are, muscle tension, fatigue, problems with concentration, sleep disturbances, because a lot of times when people are worried and anxious, they can't sleep, they're forgetful, have problems with concentrating, and they describe themselves as being all over the place. Now, of course, it is individualized because everybody doesn't have the same symptoms. So we ask, what type of symptoms are you having? And so we go from there. So that's how I would describe some of the symptoms for anxiety.
Okay. So you mentioned that a person could have anxiety and depression at the same time. Would that be similar to a the condition of bipolar where you would go from one extreme to another? Would that be considered bipolar or no?
No.
Okay, so
So bipolar is the something completely different from what we just talked about, the anxiety and depression aspect. Bipolar is more of having two polars where you're on a high end, where you're happy, go lucky, you overly happy, and then you crash down to a depression. So
Mhm.
that's more like bipolar that you just spoke about. So
Okay.
it's different when you talk about those two areas because we look at, some people come in with depression and they may have bipolar depending on, how long they've had the depression and other symptoms that has gone along with it. We usually look to see if there's been any time where They were unable to sleep for more than 3, 4 days, which would
Okay.
indicate some type of mania, depending on other symptoms. We just don't go by just one symptom. We do ask about several different things to make our determination on if they're bipolar or not.
Okay. So you all offer what is probably called a individualized plan of services.
Exactly.
Right. So there's not just, you can come in, one person may come in and feel that they have anxiety, but it could be a whole combination of conditions rolled up in one. And that's why it is very helpful to have a holistic plan of services. Okay.
Exactly.
So tell us a little bit about how would you treat a person that came in. Well, first of all, you would do some type of testing, correct? So what type of testing would you do, including a psychiatric evaluation, which is conventional, and or any type of holistic type of testing, what you would do?
Okay.
Did that
So
make sense?
so basically, our psychiatric evaluation has a lot of the test questions in it. So it's not like we necessarily have to do specific testing
Okay.
because the questions are kind of built into the psychiatric evaluation. And
Mhm.
so going through the psychiatric evaluation, we're asking a lot of questions that probably would be on some sort of standardized testing.
Mhm.
But once we get through the evaluation, we're able to determine, a diagnosis for that individual for that day. So it's a lot of questioning that we do, and it's, medical, mental, social, so your eating habits. I mean, it encompasses
Mhm.
a lot of different things, and that's why we call it holistic because we are looking at the whole aspect of the person, not just the symptoms.
Okay. And the person would have a choice. Now, I know you work, and I don't know, are you only with the New Life Alternatives now, or are you still in private practice at an office where you do both psychiatric psychiatric mental health at a mental health facility, and you also do the New Life Alternatives virtual? I know you do both virtually, correct? So,
Yes.
because everything, since COVID, everything's pretty much virtual in terms of telehealth, telemed, and telemental health, and everything like that. So, um, did I answer the question? Did I ask the question and answer the question?
So 75% of my time I work with New Life Alternatives, and I do consult outside of New Life Alternatives with other companies. But
Mhm.
basically, New Life Alternatives is where I work the most of my time. And it is virtual right now.
Mhm.
So I'm hoping to be face to face eventually. But
Mhm.
right now we are virtual.
Okay. So if I were to come in and say, because a lot of times I think we self-diagnose ourselves and say, oh, I have anxiety, I'm depressed, and I think some of the feelings are a lot of people are very educated now about mental health. I mean, you can go online and get a app that talks to you about symptoms, and you can answer some questions, and it'll give you like a synopsis of what you're going through. So there's so many ways that people can um, learn about mental illness. And I personally think it's really interesting because when I started working in mental health, and this was in the mid 1980s, I would say, you didn't hear anything about people. There was still a
Stigma.
stigma about mental illness even then, and even before then it was even worse than that, obviously, but it's just amazing to see. Now we have commercials, and now we have online apps, and now people are coming out of the closet, so to speak, about mental illness, and not afraid to talk about it as much. Um, if I were to come to your office and say I'm having I feel depressed or I feel sad, what would I expect if I were to come to your office, or if I would have a first virtual visit with you?
Okay. So you coming in with that chief complaint, of course, is going to be at the top of the list of, things to ask you around your complaint. but there's also going to be a full evaluation still done on every aspect of what could be going on. And then at the end of that, then we'll have a discussion of some things that we might want to put into a plan for you.
Mm-hmm.
So, and that could look like, a diet plan, that could look like exercise. It could look like a lot of different things based on what we get, information that we get from you personally. Like you said, it is individualized care.
Mm-hmm.
So it just depends on, what's causing the depression. We kind of try to look at any triggers or anything that could have started this depression, because getting to the root of the problem is what we try to do, because we feel that if you get to the root of the problem, you can resolve the issue
Right.
if you get to the root of the problem. But if you don't know where it's coming from, then that's something that you have to work on in order to be able to resolve the issue. It'll just keep coming up until you actually resolve the issue.
Okay.
So once we do your evaluation and decide what treatment plan you're going to follow, basically the standardized care that we definitely want to make sure that you have a therapist if you are, having depression. We want to make sure that you're doing that. And there's some exercises that we recommend. There's
Mm.
diet practices we recommend, and there's maybe supplements that we recommend.
Okay.
And we do lab results to see where your labs are, to see if there's anything that may be low that's causing the depression, or if you have underlining symptoms or anything going on as far as any medical issues like diabetes or hypertension
Mm.
that you are unaware of. So we kind of check the labs to check for those things as well. We also do a gene site testing for people who are interested. And what that entails is just to see what your body said that medications that you can actually benefit from taking. And then there's
Mm.
things that you may not benefit from taking. So we definitely want to make sure that we're fine tuned in on whatever we can do that's going to optimally optimize your mental health, is what I want to say.
Okay. So you did you say gene testing? I
So
didn't.
yeah, there's a gene site testing that
Gene
we
site.
do here in
Okay.
order to determine what medication fits right for your body type, or your gene, what your body can break down as far
Oh,
as
okay.
medication. Some people have side effects from medications because their body is not able to break that particular medication and utilize it the way it's supposed to be utilized. So it causes some problems. So we try to fine tune in on that. If we do medications, if we don't do medications, then there's other things that we look at, and then we, you know, um, prescribe or recommend based on that.
Okay.
Mhm.
So now the gene site testing that you do to determine if you have side effects to psychotropic medications you're referring to? Because that's kind of new. I had never heard that before.
Oh, well, it's not that new.
I mean, to me, I had never heard of it, and probably to the maybe to
No.
the viewers and the listeners.
But yeah, a lot of people are not aware of it, because a lot of providers may not use it, but we do, because we want to make sure that we're trying to pinpoint exactly what's going to work for you. We don't want to do trial and error. And so a lot of people come to us who have been on a lot of medications. And so we say, okay, well, you know what? Let's just do a gene site to see what medications interact better with you. And so GeneSight has been around. I've known about it for at least over 7 years. It probably
Okay,
has been around even longer.
okay,
So, but I like it because it does give me somewhere to start as far as that interaction with medications, should we decide to go the medication route.
right. Well,
Mhm.
that's, I mean, it's very interesting. You said it's been around about 7 years because that was going to be one of the topics I wanted to talk about. Would be the side effects of the psychotropic medications. Because when I was working in the psychiatric hospital as a recipient's rights advisor, which is like a patient advocate, one of the things I had to do was attend the pharmaceutical meetings. You know, the pharmaceutical reps come in and they would do a meeting to talk about new drugs and stuff like that. And I was in the meeting sitting next to one of our psychiatrists, And I was asking him about the side effects, and he basically said that every medication, I guess at that time talking about psychotropic meds, and I would imagine even other medical drugs, all he said all have side effects. I'm quoting him, and they didn't at that time know what the side effects would necessarily be and how they would interact with other drugs. So I think this is something very good to note, that there is a way now to determine what side effects you could have from taking these drugs, correct? And in the event that you determine if they may have side effects because of the gene site testing, would they not be able to take psychotropic drugs, or would you just offer herbals or other remedies, or what?
So the gene site testing doesn't really test for side effects. What it
Oh,
does is it just check for medications that is saying that your gene, based on your DNA that they swab and send to the lab and stuff, if it is good for your body to break down or whatever,
I
to be
see.
utilized in your body. But as far as side effects, yeah, I agree with the person that you talked to earlier. There are side effects for every medication, but we don't always get those side effects. And sometimes that's what I have to explain to the clients. Yeah, all medications have side effects, but it doesn't necessarily mean that you're going to have those side effects from the medication, because everybody is different.
Right.
The gene site testing may be a way to maybe have a medication where you won't have, if you know that, this gene site testing said this medication is good for you, then
Mhm.
maybe this particular medication, you won't have any side effects from it. But that's not guaranteed. But there's a way of just, proactively, making sure that we check that things. And then as far as interactions with other medications, there's tools out there to check to see if there's going to be any interaction with you taking a psychotropic and maybe with a birth control pill or something like that.
Okay.
So there's tools for that as well.
Okay. Now you mentioned that you work with children. I may come back and have a well, let me stay on the topic of side effects for just a second.
Sure.
If a person well, what if a person just decides that, well, i'm I just don't want to take a psychotropic medication for whatever reason, and they just don't want to do it? What can you offer if someone is actively having symptoms or psychosis? And if you can just define what I'm saying, symptoms and a psychosis is a symptom, correct? I mean, if someone is actively having psychotic symptoms where they might be, and you can describe them better than me, they might be, um, oh, how do you say, or how would you define psychotic symptoms? Maybe I'll let you find it and then I can clarify my question.
Psychotic symptoms can be hearing voices, seeing things, having delusions of, being someone that you're not. Some people describe it as disassociation. Some people describe it as not feeling like myself. So again, psychosis being a symptom can be different depending on the person that you talk to. Um, Someone that's really psychotic, out of control, or just really anxious about it, there's those are different symptoms. They're more severe and sometimes may have to be hospitalized for those severe psychotic symptoms.
Right. And then in that case, they would, because I guess one of the questions I get a lot now is, why did they close so many long-term care facilities, right? And
Mhm.
that a lot of these individuals were put out in the street and they are committing acts that lead to, violence, et cetera, and they have to, and they're being put into um, uh, jail facilities, right? And they're not, so when someone is like that, I would imagine in that extreme case, they would have to have some type of psychotropic medication to balance out their symptoms, and then get them on a regular medication that they can take on a daily basis to sustain that. So have you ever, or I know you have, but how would you address a situation like that?
So someone that's, like I said, psychotic and maybe, not have much control would have to, maintain control in order to be able to follow any type of regimen. So medication, hospitalization may be warranted for that particular individual.
Mhm.
And it's really strange that you talked about back when they released and closed all the long-term facilities. I remember that happening. But what I saw positive out of that was that these people were now being integrated into society. So it would
Exactly.
make the society be more on board with helping these people get the help that they need and being more personal, as opposed to not having that separation of from them and us. So them
Right.
being that they need mental health assistance with that stigma of that they, if they're out of control, they shouldn't be in society. They should be in a long-term facility,
Right.
which if they're worked with and they have the right resources and the right support, they can function in society and contribute to society just like anybody else. But to
Right.
put them away in these long-term facilities doesn't actually help them to integrate into society.
Right.
Yeah.
So and and that was my understanding too, and I think that was one of the positive things that when it comes up, I let people know that a part of the whole, and they called it deinstitutionalization of the hospitals and moving people into the communities so that they can have more of a normal lifestyle, and that there are psychotropic medications that do support that, and I one experience that I had when I was working in the psych hospital, Northfield Psychiatric Hospital, you remember, which was one
Mhm.
of the ones that was closed during the
Yes.
deinstitutionalization process. And I was working with a client. One of my jobs was I had to, whenever we had a new admission, I would have to tell them what their patient's rights were and so forth. And this one guy I met with, he was very psychotic. I don't know if he understood anything that I was saying, but I still had to tell him what his rights were. And I was just amazed at, and I don't know if it was because it was a substance abuse incident, because I know some mental illnesses are brought on by substance abuse, correct? Okay.
Yes.
So
Mhm.
I didn't know what the situation was, but I, did my job that day. And it was about a month later that I was going back in to check on him, and he was a totally different person. And I was just amazed that, he had been, and I had never been one I never, I'm like, if at any means possible, if I can avoid taking any type of drug, I'm going to always choose, the natural way. But I began to respect the medications because his whole demeanor was totally different, So um, I don't know what the medication was. I knew it at the time, but I was just impressed that people could live a whole different lifestyle. And my mother she was a psychiatric patient for most of her life, and she was always on psychotropic medications. And God bless her. I don't know how her body took her to 98 years on the medications, because of the so many side effects. But yeah, so I do totally respect the medications, but I know a lot of people are don't want to, not afraid, but they don't want to take any type of drug because of the side effects.
Yeah.
So with that being said, if someone is not wanting to have anything to do with psychotropic meds, what type of alternatives would you all offer if they were not, if it wasn't a chronic situation where they had to be hospitalized for a certain period of time?
So what we would do is lifestyle changes. And like I said, that could be looking at, adding supplements, maybe herbal therapy, That could be incorporating meditation, exercise, different other modalities to bring that balance back to them, and in order to for them to feel as though they're making some leadway. But they do have to be proactive in everything that we do, because it takes them to be able to follow through on whatever it is that we plan for them to do.
Right.
So
So,
what we're doing is checking to see if they're able to, follow through on the plan, and how they're feeling throughout the plan, and what comes up, if anything comes up that we can also address, and
mhm,
maybe have more resources, more support in the community, more support at home, whatever the case may be.
okay. So, Dr. Adolphus, how can people contact you? I know you have a website, you have a phone number. You also do the 15-minute consultations for free. I want to make sure we share that information. And I have the information here, the phone number, if you want to contact Dr. Sabiria Adolphus. And by the way, if you're just joining us, we're talking to Dr. Sabiria Adolphus. She is a naturopathic doctor, also a psychiatric mental health nurse practitioner with the New Life Alternatives, where they integrate services. They offer Eastern and Western medicine for mental health services. And if you want to contact her for a 15-minute free consultation, you can reach her at 586-271-0351. Again, that's 586-271-0351. And if Juan caught that, I hope, Juan, maybe you can put that number up for us. And then if you have, and what is your website?
So I just want to correct the number. The office number is 313-915-9138.
915-9138.
Yes.
Okay.
So yes,
Okay.
313-915-9138.
Okay. Where did I put? Oh, it disappeared, Juan. I was going to type it in, but it disappeared. Okay. 313-915-9138 is the office number.
Yes.
915. Okay. Thank you. Okay.
Okay.
Yeah.
And
Severe.
I'm going to also put in the
The
website.
website. I think you can type it in. Can you type in your website?
Mhm. Yep. I'm going to type in the email as well.
Okay.
That is the email.
Okay. And so, and then once Juan gets that, Juan, if you can put that up on the screen, her contact information. Okay. So, we talked about, okay. All right.
And that's the
So,
website.
okay. All right. And so how long now, you said you've been doing the New Life Alternatives for 3 years now. And I always like to ask when I'm working with people, and no matter what their field is, I know you have you have children and grandchildren and everything. And they always say it's hard for, like, example, a minister or a police officer or even a psychologist um to impose their techniques at home. But have you ever had to use your techniques with your children, and how successful has that been? Or do you have, your children have been great? You have probably haven't had any because I've met your
Well, my
daughters.
children have been great, but yes, I do utilize some of the techniques that I use with my clients for my children if need be.
Uh-huh.
So for, stress and, anxiety and things of that sort. So I do recommend herbal stuff for them. And vitamin D is a big one for my clients as well. But I recommend that, people are on vitamin D because Michigan doesn't have a lot of sun
Right.
certain times of the year. So our vitamin D gets depleted, which can cause, some melancholy, some sadness,
Mhm.
some, some seasonal affective disorders that we call based on, having a low vitamin D level. And just some people with the season changes, they just go through some, changes with
Ups and
their
downs.
mood. Yeah.
Right. Okay. So with that being said, what other vitamins just to support as a preventative? What things would you recommend as a preventative to support your mental health
I would say
in
vitamin
addition
D,
to vitamin D?
yeah, is the biggest one
Hmm.
because everybody is so low. Everybody I test, they're in the single digits when you should be like ranging from, I would say, they say 30 to 100. So I get people that's in the single digits. So that's really low. So
Mm.
vitamin D would be a good preventative measure for mood, you know, um, mood imbalance. So.
Okay. And is that 30 to 100 milligrams or?
No, when I say 30 to 100, I'm talking about labs. So their labs should be the vitamin D level labs. You usually run between 30 and 100.
I
However,
see. Okay.
my clients are on the low end of 30, and
Hmm.
most of them, like I said, when I've tested, have been in the single digits. So they're not even at
Wow.
30.
Okay.
So I try to get them in the middle of that, of 30 and 100. I try to get them in the middle. So suggesting vitamin D as a supplement is one of the things that I do recommend highly.
Okay. So, but you recommend being tested first, or would there be, because you can buy vitamin D in the health food stores or really just about at any store now. So, what dosage would you recommend of vitamin D on a daily basis for mood balance?
So I base that on their age. So if you're younger, I usually say about 2,000 IUs. If you're older, 5,000 IUs daily. However, we do, and a lot of the primary care physicians are doing vitamin D levels too. So we do vitamin D levels to see where they are, but most of the time they're low, like I said, and so um, having starting a vitamin D is good, and then
Mhm.
you can always get yourself chest tested. So it's like
Okay.
you can't overdose on it pretty much if you stay within those ranges, that 2,000 to 5,000 IU range
And you
is.
said 2,000 for younger
Yeah.
and
Mhm. Yeah.
5,000 for when you say older, you mean over 40,
Well,
over 50,
yeah, I
over.
would say, yeah, I would say 40 and over. But
Okay.
like I said, eventually getting your vitamin D level checked to see where you are.
Right, that's the most important.
Yeah.
So do you do any work with any other supplements? I
Uh,
mean,
yes, I do. I use B complex a lot because
mhm,
the B's are really good for your nervous system.
mhm,
So a lot of people that are under a lot of anxiety and stress, you're burning your B's, and if you're
mhm,
not taking it in through your food, then supplementing would be really good for your nervous system to
mhm,
kind of calm that nervous system down. So yes,
mhm.
that is one of the other ones that I do recommend.
Okay, so a person that is like a vegetarian and they're not, because now the B complex vitamins, are they found more in animal meat, or how would a vegan or a vegetarian supplement for that?
So yeah, so basically a lot of the supplements are food based.
Oh,
So you just have to look for the ones that are actually food based. And
so the ones that you all recommend are food
yeah, I
based.
usually recommend the food based because they're easily absorbed in the
Oh,
system and, pretty much like food. So I do recommend the food based vitamins.
okay. And do you do any work with, I know you all do emotional freedom technique, right? You have someone
Hmm.
on your staff that
Hmm.
does that.
Yes.
And do you do any work with, the acronym is EMDR, eye movement, desensitization, what is that?
Processing.
Reprocessing. Okay.
Yeah.
Can you
So
talk a
eye
little
movement
bit?
desensitization, reprocessing,
Reprocessing.
EMDR. Hmm.
Okay. The reason I'm asking about that is I was at a meeting on Saturday, and we had a therapist there that specializes in EMDR, and I found it very fascinating. So, do you offer that at your clinic, and at your facility, and can you talk a little bit about it?
Well, yes. Actually, I just finished a training on EMDR. It's really
Oh,
ironic that you would say that, but
mhm,
yes, it is a very interesting modality. I um, I found it very helpful with trauma and other things. Um, People call in because they're getting a divorce and that's really bothering them, and
mhm,
using those techniques can help desensitize those feelings and stuff that come up. So with EMDR, what you're doing is you're using a stimulation in order to desensitize. And so that movement or that process of desensitization that's doing is in the movement that you do. And sometimes it's a eye movement. It's the one
mhm.
that they, talk about, the eye movement. But there's
Right,
also another technique that we can use is tapping,
right,
tap ourselves. Or there's also handheld vibrations also too that they utilize.
uh-huh,
But it's that's the part of the desensitization part of it. And
mhm.
then you are, working through whatever that negative stimuli is, you're working through it to reprocess it so that when it comes up again, it's not as disturbing to you.
Okay. Okay. Yeah, it was I found it very interesting, and she did a little demonstration with us, and she said that almost any type of bilateral movement on the body, we tapped on the thighs and then did this tapping that you were doing in the eye movement. So I want to also delve in. I know we're kind of talking about a lot of different things, so it's kind of like an overview of the holistic approaches that you use. And I want to be able to share with the people that may be watching or may watch or listen in the future. So if they can reach out and possibly see that there are many alternatives to mental health, and in conjunction, we use the term now integrative medicine. So it sounds like at your facility or facilities, you all use an integrative approach, so which includes the conventional psychotropic medications and evaluations in addition. And I think that's really in addition to the holistic or Eastern type styles of treatment, including herbals and meditation, as you said, and probably, I know you also incorporate yoga practice, because I know you do Kundalini yoga yourself. So, um, but I wanted to just kind of do a big overview of everything. And by the way, let me ask you, what do you do for your own to support your own health and well-being?
So, good question. I do a lot of things. Uh,
Right, right.
like you said, I do the yoga,
Uh-huh.
I do meditation. I myself take supplements, during the winter
Mhm,
time for, not getting enough sun. So I supplement with vitamin D. Um,
mhm,
I have talk groups where, other professionals like ourselves, we just get together and we have, interactions and talks and stuff like that.
mhm,
So all those things really help with kind of self-care, so to speak.
mhm, mhm.
So just being in tune to yourself when you're taking care of someone else. So we
Right.
try to make sure we're doing self-care to keep us from getting burned out and
Exactly.
to keep
Yeah,
us on top of our healthcare as well as, providing for others too.
absolutely. Well,
Mhm.
I have to tell you, I know you do. I teach yoga and I do Kundalini yoga. And Kundalini yoga, and I know you are a big proponent of Kundalini yoga, is one of the best forms of yoga that I have ever experienced. And it's the one that I choose, in my personal practice, because it truly incorporates the mind, body, and the spirit in that practice. And actually, we're going to be talking about in my next show next week. We're going to have your good friend Yvette Cobb on. She's also a nurse. She's a nurse, and she's going to be here next week talking about Kundalini yoga and the benefits of that. Thank you so much, Severia, Dr. Adolphus, for being on the show today. I really appreciate you coming on and sharing all the information. If you could just give us that number one more time that the people can contact you for that 15-minute free consultation and the website, please give us that number again.
Sure, it's 313-915-9138. I think it just came over the screen.
It's right on the screen. And then your website?
The website is telemedicine, spelled all the way out, Michigan.com.
All right. Now, thank you so much for being here. Thank you all for watching or listening. And please join me next week again at 11 o'clock on Wednesdays for the live show. Or you can go to www.w4hc.com to look at the replay or anywhere you watch your podcast. So thank you for being here. Until next time, stay safe, stay well. Namaste.
Thank you for having me.